Thank you. Good afternoon to all. What I would give in a nutshell is a strategy which has taken a couple of years to develop and was finally adopted by the organization as of last year. Now, before I begin, just a brief summary on the dengue situation. Now, I'm sure Professor Simon has already spoken to you today morning, and you would have seen a better picture of the burden of the disease. But having said that, just to brush up our mind, the conditions which favor dengue, you all know. These are basically movement of goods and people. And of course, the trade of used tires has also led to the proliferation of vectors. And this map is again taken from the group of Professor Simon. So this is a map really showing the risk of dengue as of today. And if you really look through it, actually every continent is affected. And according to WHO records, because we collect dengue data from about 100 countries and territories on a regular basis, and these are official government submissions. And based on our records, as of 2010, dengue has been recorded in every continent. Now, I just want to highlight one particular continent, and that is the continent of Africa. Very often you hear malaria in Africa, you hear of all other diseases in Africa, and very rarely you come across dengue in Africa. But honestly, the African continent has enough of dengue outbreaks. And we have constant reports of dengue coming to us from the African continent, but very little work has been done. And there was a review which clearly shows that almost 21 countries of Africa are endemic for dengue. And in a very simple way, if you want to put it, actually malaria and other diseases have masked dengue in Africa. And now that malaria is on the decline, people are taking the initiative to check the samples, and they are finding more and more dengue cases. So Africa is an area where very little has been done, but there is a lot to be done for dengue control there. Same with Europe. Today morning you heard about the ECDC presentation and the ViborNet and so on, and this is actually from ViborNet. The European Regional Committee, we call it Regional Committee because WHO is highly decentralized. We are broken down into 6 regional offices, and each regional setup has its own annual meeting. We call it Regional Committee, where all member states' ministers of health attend. And the European Regional Committee met last month and adopted a resolution on controlling invasive species of mosquitoes. For the first time, 51 member countries unanimously adopted the resolution to take measures to control invasive species of mosquitoes. And this is because of the influx of Aedes albopictus into almost 15 European countries. A table went missing. Actually, what I wanted to show in that table, I just don't know how it shows up on my computer, but not on this. What I want to summarize in that table is, if you really compare dengue and malaria today side by side, the number of countries affected by malaria has gone down to 99 now. And about the population at risk of malaria is around 3.2 billion people. But today, dengue is prevalent, or people are at risk in over 128 countries, and the population at risk is over 4 billion. The number of infections, we are almost neck to neck. The only factor where malaria and dengue differ is in terms of death. 660,000 people died of malaria in 2010, while dengue kills about 21,000. This is the only difference. But in terms of infection, severity, people at risk, dengue is far higher. Now, why did we have this new strategy? The strategy of WHO was about 17 years old, and it was time that we need to change because there has been a lot of developments in dengue, one of them being the improvements in diagnostics. We have more and more diagnostic tools coming in, but we really need to develop their quality. The case management has significantly improved, but we are also seeing epidemiologically an increase in severe dengue, mainly in the American region. We also have a new case classification. Integrated vector management is increasingly being applied by countries, and we have several new vector control tools, many of which you heard today. There are at least 5 vaccine candidates on the horizon. Then secondly, we are also faced with a health system which is highly decentralized. And in this situation, the program we stand to gain because we really need to train people, build capacity, and this gives us an opportunity to really put in place a good strategy where control measures are more sustained rather than being reactive. And of course, we have the global spread of vector and the pathogen. Climate may contribute to the spread of dengue, apart from demographic changes. So essentially, if you really look at what happened at the organization level, is many things happened more from the bottom-up approach, where our regions have been crying for action. So we have had several resolutions by regional committees of the American region in 2001, the Southeast Asia and Western Pacific in 2008, the Eastern Mediterranean region in 2011, and again, the Euro resolution, which I just mentioned this year. So our goal, the new strategy, basically the goal is to reduce the burden of the disease with 3 specific objectives, mainly to reduce deaths by at least 50% by 2020, dengue morbidity by at least 25% during the same period, and of course to better ascertain the true burden of the disease. So with this 3 goals, we also have 5 technical elements, one of which is diagnosis and case management. Number 2 is integrated surveillance and outbreak preparedness. Number 3 is sustained vector control. 4 is the future vaccine implementation, and 5 is the research component. So in terms of diagnosis, we also have a small advisory group on dengue, which has been established for the past 2 years. And this group has identified, based on the strategy, what should the programs concentrate at a country level. First of all, in diagnosis and case management, we need to focus on countries with high fatality rate or high death rates and see how we can improve case management, develop proper guidelines for it, and this is already in place. We also need to carry out good death audits, standardize core case definitions, and we are also developing a curriculum for doctors which is web-based, and we need to have a better network of laboratories and experts, basically clinical experts, to address outbreaks in many of the new countries where outbreaks are occurring. And one of our challenges we still face as compared to malaria is we still need to standardize the diagnostics of dengue, especially the quality control. The second part is integrated surveillance. We need to integrate the surveillance of clinical or epidemiological cases with vector control or vector surveillance. And we need to find out who are the stakeholders to be engaged in this. We also need to study the economic burden and link clinical surveillance, lab reports, and also the rapid response in terms of vector control. And the other part which we are currently addressing and where we will have an expert meeting is to have a standardized monitoring and evaluation framework for dengue. The third point is sustained vector control. Why I'm saying sustained is one of the biggest challenge dengue faces is we do not have proper implementation of vector control. Very often countries scramble to get vector control tools or chemicals to spray, and by the time the spray chemicals and equipments arrive, the outbreak has already reached its peak. And in most of these cases, if you really go through the papers critically, there is no monitoring and evaluation in place. So we need dengue programs to have good vector control interventions which can be sustained for 2 to 3 years, just like malaria. And this has to be monitored over time. Now, actually, you have heard already that vector control doesn't work, vector control is weak for dengue, but the reality is we need to ask a question: have you applied vector control in the same magnitude and scale as malaria for dengue? In fact, the answer is no. You have distributed 150 million nets all over the world. You have sprayed 200 million houses for malaria control, but there is no such intervention of that scale to address dengue. And very often, as I said, we always panic when there is an outbreak, and you scramble for tools, you really don't know what to do, and then by the time the tools are implemented, it's already too late. So this is why we are talking about sustained vector control, and we are actually preparing guidelines for outbreak control and prevention. A comprehensive review of vector controls is being prepared. We are promoting the use of integrated vector management, and we are also discussing on roles, what vector control can play when a vaccine becomes available. Of course, one point which I just missed was the last point which Professor Hemingway just touched, is the issue of insecticide resistance. We really are at its infancy in terms of dengue vector resistance to insecticide. There's very little work done, though very many people know there is high level of resistance. We still have a lot to catch up, as compared to malaria. Now, in terms of vaccine, assuming that a vaccine becomes available in the next few years, there are at least 5 potential candidates in phase 3 and phase 2 trials. We need to identify priority groups, because as I said in the beginning, we have a population at risk of 6 billion, of nearly 4 billion out of 7. And we need to identify groups, localities where it can be delivered. The cost is important. What coverage are we looking at? Then post-vaccination, we really don't know how long this vaccine would be effective, how many doses are required. So all these issues still remain to be answered, and we need to come up with answers for all this. And of course, the last point is, in case we have a good vaccine, and if the product has got a real drive for public health, then we can identify countries, especially island nations, where dengue can be eliminated, vaccinating the whole population. For example, Fiji, Samoa, Caribbean islands could be the first target. But there is a potential there. But having said that, we still need to think about all other possible avenues. Okay. The operational research, one of the issues we are looking at is the burden estimate. And this is something which we are going to discuss with more broad-minded partners and stakeholders to come up with a much better burden estimate and standardize estimates of dengue, just like how Global Malaria Report summarizes things. And we need to evaluate models, especially on vaccines and vector control. We also need to study whether serotype switch has a role to play in dengue outbreaks. And we need to develop new tools and give avenues for the implementation of new tools of vector control, which are now coming into the horizon. So we need to also see the testing procedures for this, and we need to find out where these tools can be better applied. Now, in order to implement these 5 key technical elements, there are some enabling factors. Especially for dengue control, we need a sound communication and behavioral outcomes, especially with communities. We need, of course, greater advocacy and resource mobilization. Partnership and coordination is very important, especially because dengue is not really a health issue. In most countries, dengue is a cross-cutting issue covering health and several other ministries, and we need to work together. There are countries where dengue vector control is completely under the Department of Environment, and Department of Health just takes care of case management. So we have a long way in terms of how we are going to work together at a country level in terms of coordination. Capacity building is another issue. There's hardly any expertise around, especially for dengue vector control, and this is a universal problem of shortage of entomologists, and we need to do much more on that. And the last but not the least, we need a much better monitoring and evaluation of dengue programs. I think that's my last. And one last sentence which I really want to remind every one of you is, next year, World Health Day, on Monday, 7th of April 2014, the theme will be vector-borne diseases. We celebrate World Health Day as the birthday of the WHO, and it is it is definitely a campaign of our Director General, and you will hear more about it, and in whatever way you can contribute, please do help, because this is going to be observed on the 7th of April. Thank you.